Well, hello everyone. It's me. This is Bill behind me. Hi to our live stream. He is our wonderful director. Literally just got out. Who else wanted to say hi? Oh, Greg Rugen doing some legislative story that I've already forgotten about because there's been so much going on. But thank you so much for joining us today, either on our Facebook page, our YouTube, or on our website. Now, this is something, let me just tell you. When I was little, I would have chocolate chip cookies in the middle of the night. Yep, I did. I did it. And I would go back to sleep. And I've had a lot of cavities in my lifetime. I have sealants on all my teeth now. And you can't even tell, right? See? But tooth decay is so prevalent in the U.S. According to the National Institute of Health, it is the number one chronic disease that children in the U.S. have to deal with. We're talking more than diabetes, more than obesity, which we talk about all the time. And I am so glad that one of our very favorite dentists, who's actually my dentist, we're bringing her on. She's known as the Texas Tooth Lady. Here she is, Dr. Terry Alani. Hi there.
Hello. Rose, I have to tell you, I don't know how I became a dentist because I had 8 cavities in the 4th grade. 8. My parents thought I was going to have to hold my teeth out because I never stopped eating candy. And here I am, a dentist.
I mean, but you look great. Look, your teeth are wonderful. So you're a success story, but it's all about like making sure that kids don't go through that. And, you know, it wasn't that our parents weren't giving us nutritious food. It was just, we were just kind of rebelling and just kind of not brushing our teeth. And that's like now as a parent, it's different because now I'm trying to get my daughter who, it's like I've explained, like an angry raccoon, like trying to get her to brush her teeth. And there's so many things you can do, so many tips that you've given me, and they've helped a lot too. So I just wanted to share that with everybody else because I can't believe tooth decay and cavities. That's such a big deal, especially with the summer. You know, it's like when school's out, so you're out of your routine. But this is one thing that you do not want to stop doing, which is brushing your teeth. Because, I mean, you eat, you're going to need to brush your teeth. Exactly. It's nasty if you don't for a lot of reasons. And I was talking to my coworkers about it and how I hate flossing and whatever. And they were talking about how you can get the water toothpick or whatever.
Yeah.
On Amazon. And I was wondering, is that like effective as the floss?
So it might surprise you, but I hate flossing my teeth too. I hate it.
This is great.
What works the best? This is what I advise my patients to do. And I floss, but also those soft picks, you can get them over the counter at a grocery store. They're little soft toothpicks. And what I recommend doing is you can put them if you have a mouthwash, turn your mouthwash over. So in the cap, there's a little bit of solution. Then you can take that little soft toothpick, put it in that little cap of like Listerine or what have you, and then go in between each individual tooth, and you will be amazed at the food that comes out of there. It's very effective. So for those that hate to floss, but of course, nothing beats flossing and brushing.
Oh, yeah. Yeah, for sure. And, you know, so how do you act when like you're flossing or your hygienist is flossing the teeth and the patient says they floss all the time, but they're all bleeding everywhere? Do you just kind of like, okay, we know you're lying.
It's scared to lie to the dentist, but we're very gracious and we just give them a gentle reminder. And actually, I give them a mirror and I show them the bleeding gums because healthy gums simply don't bleed, as we know.
Right.
The mouth is the gateway to the rest of the body. So if you're having gum disease, you probably, and a severe gum disease, you're probably prone to diabetes, to heart disease, all other kinds of issues.
Right.
So that's why it's so important. And we start with children. So it's really getting your kids to the dentist as early as, they say 2 years old. I could say 4. 4 is probably a little bit more realistic. And take them to a pediatric dentist where they can have some fun and educate them early, because going to the dentist does not have to be a painful experience. You know, people come into my office and they go, oh, I'm so anxious. But honestly, nowadays with all the treatments, it just really does not hurt. I always say, if you've got a tattoo, you cannot complain in my office, because I think tattoos would hurt. But as far as going to the dentist, it's just not like it used to be. It's much easier. much
It
less.
is. It is. And I mean, what was great was that you used the water thing on me instead of, picking like, and that hurts the hygienist or dentist because they're having to, they have carpal tunnel and all that because they're using all this strength to do that. So, it definitely throughout the years, it's become a more pleasant experience. And, there's been so many questions parents have about when it comes to oral health. And one of the things is, when should your child see an orthodontist?
Okay, so you want to first of all, you can catch things early. So you would like for them to see start at 7.
Mm-hmm.
General dentist usually will recommend you seeing the orthodontist. And if you're going to wear braces between 9 and 14 before puberty sets in, because it's a lot easier to move the teeth. So for my children, let me give you an example. My daughter, I took her into a friend of mine that was an orthodontist as early as 7. He did some preventive work, and then she went into regular orthodontics at 11 years old.
Mm-hmm.
So it's usually before they're 14. And, there's different types. There's Invisalign now, and there's regular orthodontics, the braces. So which one is best? Invisalign's traditionally a little bit more expensive, but as you know, it's just the clear trace, so you don't have that metal in your mouth. However, sometimes there are certain situations where braces are better, and because if your child takes those trays out prematurely, because you're supposed to wear them 23 out of 24 hours a day, they might not be as effective. So sometimes traditional braces may work better. For me, I prefer Invisalign in teenagers, a little bit older, because they can keep their teeth clean. We see a lot of gum issues in people that have traditional braces. However, I would allow the orthodontist to make the recommendations necessary because they know best.
Okay. One of the other things is you were talking about nutrition and how that's so important to prevent cavities. What are you seeing in your practice when it comes to the correlation between diet and your oral health?
No brainer, Rashi. I can tell you by looking in the mouth exactly what their diet is like, because for patients that have a lot of plaque, a lot of cavities, they're probably eating a lot of simple carbs, crackers. Crackers are probably the worst because they stick to your teeth and they just stay on your teeth. If you've eaten crackers, Cheetos, things like that, you'll notice. So what you want to do is for children, you want to steer them more towards, maybe a little boring, but yogurts, cheeses, nuts, even chocolate, raisins have a tendency to stick to your teeth. Ice cream melts, so it's not going to be as toxic to your teeth as, say, some of the other simple carbs are.
Okay. And are you seeing also, like, with tooth decay, like gum disease, is that increasing as well?
I would say during COVID, of course, right after, everybody was neglecting the dentist. Nobody wanted to go in for fear of getting sick. Nowadays, I think that people are a little bit more aware with the rise of social media. They want to have nice looking teeth when they're taking their selfies or their Zoom calls. So I think people are a little bit more aware now. And basically, I would say that people probably take better care of their teeth. And it also goes with, like, low income families may have a more difficult time. It's really the parents being informed so they can actually educate their kids. So that's really important.
And when you're talking about teeth too, it's important to note that going to your doctor or your dentist to get teeth whitening that way, how is that different than, because I know teeth whitening is so huge. You talked about Zoom and selfies and all of that. How is that different than what you would get, like, say, at like one of those other places where it's like you pay $100 and you get something done?
So you get what you pay for, right? $100, not going to do it. Our concentration of whitening is much stronger, and because it's handled by the dental professionals, so it's going to be much more effective. Even the home whitening gels that we prescribe for our patients, much more effective. Your concentrations that you're getting in these kiosks and things like that are just not going to do the job. I honestly feel like it's a total waste of money. So if you're going to whiten your teeth, it's just to spend a little bit of money and get it done properly.
Okay. I did also don't know why sometimes it does that when I like show the website, but yet, wait, hold on. That's not working either. That's weird. Okay. Well, we have your website, and let me see if I could, there we go. Unmuting the mic here. Can you? Okay. So my mic is not muted. But you can see all the things that Dr. Alani offers here. I don't know why her mic is muted right now, but something that we're talking about is obviously the smile gallery. That's what you're seeing here. Snap-on smile. That's one of the big things that you do too. So if you could just kind of talk about that, Dr. Alani. Sorry that you're not able to talk, but that's one of the things that, yeah, I can hear you now.
Okay. All right. So Snap-on Smile really is an affordable option to those people that may not be able to afford veneers or orthodontics. And it's basically an appliance that literally fits over your existing teeth and snaps on. You wear it like a wig, like a necktie. You wear it when you want, you take it off when you want. There's no adhesives, there's no drilling to the existing teeth. It's just simply a cosmetic appliance. Some patients will wear it if they're getting ready for an implant. They have a missing space, they need something to cover the space. But what it does, it not only is a cosmetic appliance, it can whiten your teeth, it can change the shape of your teeth, and it's all done passively, and we don't alter the teeth at all. And it's called Snap-on Smile. It's a great affordable option.
That's awesome. And so I was trying to show it, and let's see if we can do that. Okay, you can unmute my mic here. The other thing I wanted to talk about were veneers, which is also very, very popular now. You see so many people doing that. So tell us about the process of getting those.
Okay, so unlike years ago when we had to really drill the teeth down, now it's just very minimal preparation. So we stay in enamel. It's minimally done where we minimally alter the teeth. We make temporary, so it's like a trial smile after we prepare the teeth so you can see what they're going to look like. And it's about a 3-week in-between procedure from the time you come in and have the teeth prepared to the time that you have the veneers delivered. And basically, they are the Bentleys, the Mercedes of dentistry. They can last up to 30 years. They're porcelain, they don't stain, they're translucent, they're gorgeous. Gorgeous.
Wow. Wow, that's awesome. And what would you say, going back to for parents, how often should your child brush their teeth and for how long? Like, are we trying to go for that 2 minutes every single time?
You know, that 2 minutes is a long time, Rashi. It's
yeah.
Like, I'm sorry. I've tried. You're supposed to sing happy birthday like 3 times. I'm like, forget it. I say, make sure your child loves his toothbrush or her toothbrush. Make sure that they pick out the toothpaste because there's some great toothpaste flavors out there now. And then I would say 30 minutes after they eat. So they're going to drink Gatorade. Let's talk about sports drinks. Those are very toxic.
Yes.
But they also replace the electrolytes during sports. So it's a much needed energy drink. What you want to do is they can either drink Gatorade or what have you, and then swish with water and then drink Gatorade, mix it up. Or after they drink their sports drink water. You want to avoid brushing your teeth after you eat for 30 minutes because most of the foods are acidic, and that acid will end up wearing away your enamel, but it takes your saliva 30 minutes to neutralize. So wait 30 minutes after you eat, drink anything like that before you brush your teeth. So your kids should be brushing in the morning before breakfast and then at night before they go to bed. And during the day, if they're eating some excessive sugar, another thing is drinks such as pop drinks, Cokes, Dr. Peppers, whatever. You are bathing your teeth in sugar. I honestly kept those out of my house. So when we go to a restaurant, I would allow my kids to have one. But I kept them out of the house because they have like a cup of sugar in each drink. And so when you're sipping, you're just bathing your teeth in sugar. Whereas if you just drink it in one sitting very quickly, it's not going to be as much damage. And then, of course, drink water directly after because it's going to dilute the acids that are in your mouth as a result of these drinks.
Yes. And I vividly remember this dentist coming to our elementary school, and she had a student use like the hands as the teeth. And she's like, well, in the morning you have pancakes. And then she put syrup all over the teeth. And then she put like the cookies and then that's just been ingrained in my head. Like, wow, all that stuff that like kind of sticks, but obviously in a more exaggerated way. I mean, one thing my kids love is Oreos, which I totally love as well. But that stuff just gets stuck in your teeth, and it's a whole situation. So,
what you want to do, Rashi, with that is have them eat it in one sitting with their meal, right after their meal, not with their meal, right after their meal, and then wait 30 minutes, brush the teeth. So not all this snacking throughout the day. That's where you get into trouble. And, my kids were in sports. I tried to keep them off those sugared pouch drinks because I knew how much sugar they have. Another issue is putting your baby to bed with a bottle of milk. Baby bottle tooth decay causes extensive damage. So you want to make sure that your child goes to bed with only water. People don't realize this. Milk has a lot of sugar in it. Fruit juices, a lot of sugar. So where you get into problems is when you start bathing the teeth in sugar. And that's what parents need to think about. So for instance, chocolate melts in your mouth very quickly. So the damage with chocolate isn't as much as, say, the damage would be with a gummy bear or something super sticky. The other thing I would like to emphasize is sealants in children. Really important to put sealants on your children's teeth. People ask why they're not decayed, because you don't want them to be decayed, right? It really helps prevent cavities. And fluoride, if your child is drinking nothing but bottled water, you're doing a disservice by not putting fluoride, because fluoride really, really, really does prevent cavities. And even if it's just in your toothpaste. I know there's parents out there that are against fluoride, but in small quantities, it's going to really help with preventing tooth decay.
Yeah, I mean, I can attest. I got sealants when I was younger, and it really helped. I mean, it wasn't like I brushed my teeth and, I would get cavities. It was I brushed my teeth and then I ate food afterwards in the middle of the night. So obviously that's going to cause those cavities. One thing I was going to share with you all is something that I found that has helped me with my kiddos. They're 6 and 3. I have this chart that you can get online. There's so many of them, but it's like, I don't forget where this chart is from, but this is the one that I use. And so, they check mark their, morning and evening, and they do get this. And Dr. Alani, I don't know if you're going to like this, but they do get one pass per month. So they're like, can I have my pass today? So you get a pass per month if you've checked all those things. So that's like the treat that they get, but everybody has their thing that they get to put on there. So I think charts work. And also how you were saying, which also helped, was my daughter picked out a little princess toothbrush, and my son picked out his thing. So I think getting the kids involved is the best thing to do. There's so many people that say, oh, I don't really go see the dentist. My teeth are fine. What do you say to those people? Because I mean, I feel like it's almost too late with no dental experience, obviously. When you
I can't tell you how many times patients will tell me that, and then we take x-rays and there's cavities, there's gum issues. Here's the deal, Rashi. Unless the cavity is involved with the nerve, cavities do not hurt. Cavities have to be very large to hurt. So our job as dentists is to address these things very quickly. And the only way you can do that is see the dentist. We catch cavities early because of our x-rays. You don't always know that you have a cavity. You don't always know that you're developing bone loss unless we go in and probe. So not everything has a symptom with it. And that's why when people say, oh, I don't have any dental work or whatever, a lot of times we find things. So there are those patients that are genetically very lucky. I've had patients that haven't had their teeth cleaned in 10 years and there's nothing to clean. No cavities, nothing. So a lot of it's genetic, it's diet. There's a lot of different factors. But most patients definitely need to see a dentist twice a year, and x-rays once a year or twice a year, depending on your history of having any cavities or not. And, listen, I've had root canals in my mouth. I'm not perfect. I have some crowns in my mouth, but my bone level is very healthy. And it's like going to the gym. You take care of your body, take care of your teeth. It's really important.
Yeah, definitely. And if there's a piece of advice you would give parents, what would it be when it comes to making sure their children have the best oral health they can?
I would tell them to not neglect if a child is very defensive about brushing or whatever, find a way to make it fun and not force it on them. You have to encourage them and explain to them why it is important. So you just have to make it a fun activity. Floss only those teeth you wish to keep, Rashi.
Wow, that's a really aggressive way.
Be true to your teeth or they'll be false to you. So it's just really important for kids. And, another really good thing is to have parents bring their children to the dentist when they have dental appointments. We allow the kids back in our operatories with the parents.
Mm-hmm.
They sit there with their video games or whatever they have now, and they realize that we're not hurting the parents, that we're making it not a fun activity, but it's not painful. The parents are at ease. And so they emulate their parents. And when they see that, then they look at going to the dentist as something that is okay. It's not traumatic. We want to eliminate that traumatic experience.
Definitely. Well, Dr. Alani, thank you so much for taking the time this evening to talk to us. I know this is just such great information that everybody can really take some note and practice themselves.
All right, Rashi. Thank you so much.
All right. Thank you. And all right. Thank you all for joining us for this edition of Parent to Parent. If you have any comments or questions, please list them below, and we will see you next time for another edition.